Welcome to the 7th presentation in our series on family involvement in dementia care. Deciding on the best medications and treatments for our loved ones can be stressful. Today, we'll talk about some tips to help ease this stress when talking with providers about medications, their side effects, and other options, so you can make better informed decisions. This program builds on previous programs on talking with providers and the healthcare team openly and honestly, negotiation and finding the best solutions for care, and skills for creating partnerships to work as a team. As a reminder, this program is part of our training series focused on creating a partnership approach to caregiving. Partnerships involve working as a team to assure your loved one with dementia receives the best possible care. When applying this in deciding the best medications and treatment options, being a partner with your loved one's healthcare team relies on two-way communication, asking questions or for explanations, and bringing up concerns about medications or treatments. Partnerships also involve being prepared for changes related to the disease progression. A common question is, which medical treatment is right for my loved one? Healthcare providers have the responsibility to help patients and their caregivers explore treatment options. They can help our loved ones express their preferences. However, it is important to remember that everyone is different. Personal values and preferences for medical care cannot be accurately predicted by most healthcare providers, and sometimes not even by family members. Now let's look at a few tips from other family caregivers when considering medications and other available medical treatments. First, be realistic about what represents success during the progression of the dementia. Success can be that your loved one is receiving good care, is safe, and is as comfortable and happy as possible. Next, know that not all healthcare providers are experts in dementia care. Dementia is often more than memory loss, and everyone experiences dementia differently. Certain medications and treatments can worsen dementia symptoms. Educating staff and asking how a certain medication or treatment may affect your loved one will help align treatment expectations. Never be afraid to ask for help or clarification. If you are unsure about what a medication does or why it is being given, ask. You have the right to know what is being given to your loved one and why. When deciding between treatments, ask the physician what they would do if they were treating their own loved one. This may help you understand the benefits and risks between different treatments and determine which option aligns with the values and preferences of your loved one. Finally, discuss possible medications and treatment options while your loved one can still express their wishes. These wishes can be documented through the advanced care planning process or more formally through an advance directive. We will discuss both of these plans next. Advanced care planning is the ongoing process in which patients, caregivers, and their healthcare providers reflect on the patient's goals, values, and beliefs to inform their current and future medical care. This process is important because it informs and empowers patients to have a say about their treatment. The advanced care planning process typically involves 4 steps. First, have your loved one think through their values and preferences with regard to medical treatment when they are no longer able to make those decisions. Then, talk through their wishes with other family members and loved ones, as well as with healthcare providers. Support your loved one to be open about their wishes so the healthcare team is aligned with their expectations. Next, document these wishes in an advance healthcare directive. An advance healthcare directive, sometimes known as a living will, is a legal document in which a person specifies what actions should be taken for their health if they are no longer able to make decisions due to their illness. This document should be provided to the healthcare team. A social worker or another member of the healthcare team can assist you and your loved one with starting this document. Lastly, Review your loved one's wishes periodically and update the Advanced Healthcare Directive as needed. Always relay any changes to the healthcare team. When thinking about adding a new medication or starting a new treatment, there are questions to consider. First, what other options are available? Or, what happens if we do nothing? Discuss with your provider other options, such as not starting a medication or trying another treatment. For example, when dealing with dementia-related behavioral issues, modifying the physical environment or establishing daily routines may help instead of starting a new medication. Does the benefit outweigh the risks? Treatments such as prescription and over-the-counter medications have side effects. Weighing the benefits over potential side effects is something the healthcare team, including the patient and the caregiver, need to discuss before making a decision. Also, what interactions may this medication have with other medications? Or will this medication worsen symptoms of the dementia? If a medication is started, consider keeping a journal of any possible behaviors or other side effects that you think may be associated with it. Another question to consider is, how soon might we expect to see benefits? Some medications or treatments may not show benefits for years, while others show benefits shortly after being started. This leads to the next question of, how will we know if the medication or treatment is working? Lastly, it is worth exploring with the healthcare team if there are medications that may be discontinued. As dementia progresses, the risks of a medication or treatment may potentially outweigh the benefits. Let's review some common misperceptions regarding medications and treatments. For example, one misperception is that medicines and products purchased over the counter, or without a prescription, are safe and free of side effects. In fact, medicines and other products purchased over the counter often have multiple active ingredients that may interact with other medications a person is taking. It is recommended to talk with a provider such as a pharmacist before consuming an over-the-counter product. Another common misperception is that there is a medication to help all symptoms your loved one is experiencing during the disease progression. In reality, medications may have limited effects when the dementia is progressing, or on other dementia-related behaviors. Caregivers may not feel they are part of the healthcare team and are not included in the decision to start or stop medications and other treatments. You are part of the healthcare team. Speak up and let the team and facility staff know that you want to be made aware of any changes in medications or treatments for your loved one. Another common misperception is that all healthcare facilities, including your local community pharmacy, share medical records. Consider keeping a medication list with you at all times that has all the prescription and over-the-counter medications your loved one is taking. This list should include the medication name, dose, who prescribed it, and the reason for taking the medication. Also, date this medication list so you know when it was last updated. There are multiple resources for medication and other treatment information. For prescription and over-the-counter medicines, your local pharmacy or members of your healthcare team can assist with questions. Pharmacists are sometimes one of the most accessible healthcare professionals and can help answer your questions or concerns. Your local senior center or aging and disability center may offer services or avenues to have your questions answered as well. The internet has endless information, but it can be difficult to navigate through. It may be a starting point when searching for answers, but it is recommended that you talk with members of your healthcare team to help verify information found on the internet. Let's take a brief pause to discuss some of the difficulties you have experienced when considering a medication or alternative treatment for your loved one. How did you overcome those barriers? Please pause the presentation now, and then press play when you are ready to continue on. Deciding on the best medications and treatments for our loved ones can be stressful. Be proactive with understanding each treatment option and ask questions when you need more information. Be sure to document any treatments and medications your loved one is taking, as well as any side effects you believe your loved one may be experiencing. This will provide additional information to the healthcare team to help determine the next course of action. And lastly, remember that you are an important part of the healthcare team.